Hi everyone, this is Dr. Bill with Easy to Pass NCLEX, easytopassnclex.com. I am going to be reviewing respiratory disorders. Respiratory disorders that I will start with is pneumonia. What is pneumonia? Pneumonia is mainly infection of the lungs causing decreased gas exchange and ventilation, as well as increased exudate. Okay. What are some risk factors for pneumonia? Sometimes people who are sedentary, people who are chronic smokers, people who may have opportunistic infections such as PCP and mycobacter bacterium. These are some risk factors for pneumonia. Or sometimes, fluid buildup in the lungs that can become infected and can lead to pneumonia. Okay, so what are some classic nursing assessments for pneumonia? And even before we look at the assessment, let's look at some general diagnostic testing. You want to think of your imaging, chest x-ray or CT scan to identify the extensiveness of the disorder. Some ABGs can be used to determine your blood gases, what's going on specifically in the oxygen that the client is taking in or putting out. You also want to look at your CBC and BMP. You may want to draw some blood cultures to make sure that the infection has not spread to the blood, which can lead to septicemia or can lead to sepsis or septic shock. And we don't want that to happen. Okay. You also want to get some sputum culture to identify what organism specifically is growing. So some nursing assessment or some symptoms that you may identify for client experiencing pneumonia includes cough, fever. They may be febrile. They may have some chills. They may have some tachycardia, tachypnea, dyspnea, basically difficulty breathing due to the decreased ventilation or the gas exchange being impaired. The client may be malaise or tired quite often. They're going to have respiratory distress. You can, on assessment, you can identify that the breath sounds may be diminished, or in certain instances, depending on the cause, if it's excessive, fluids in the lungs causing that, you may hear some rhonchi or crackles if it's CHF related or other instances. So, with the client putting out cough with sputum, the color of the sputum may be purulent or yellow, basically. Those are some classic symptoms that the nurse may be able to assess. So what are some nursing interventions that should be anticipated for a client who is suffering from pneumonia? You want to anticipate antibacterial, right? Antibacterial to, or antibiotics basically to be administered to the client. Sometimes they may start with broad-spectrum antibiotics until the cultures or the organism is identified to use the specific one. The client may need some hydration. Unless contraindicated with CHF, you may want to hydrate the client so it can loosen up the secretions, because the secretions may be thick. So you want to hydrate the client unless it's contraindicated. For example, CHF or chronic kidney failure. So the client can be able to expectorate, the mucus. They may put the client on some bronchodilators, such as albuterol, or some steroids such as methylprednisolone to help with the inflammation that the lung may be going through related to the organism causing the pneumonia. Okay, so those are some classic nursing interventions that you want to anticipate, with the medical management for the client. You want to reassess your client to find out that they're responding to the treatment. Assess your pulse oximeter reading and then follow up with your ABGs to make sure that the client is responding to treatment for better outcomes. Some nursing education that you want to provide to your client. It's really important that you educate your client to be compliant with the antibacterial or antibiotics that's been ordered. They must complete the course even when they're feeling better. It's really important that they understand that. They may be doing some respiratory exercises such as incentive spirometer, which will help expand their lung capacity as needed. And then minimize activity and then start slow and go slow with anticipation or conservation of energy. So it is really important to educate your clients so they understand the outcomes that they will be expecting. So that is pneumonia management in a nutshell.